Welcome to the Parenting Puzzle Podcast with Dr. Daniela Owen, the podcast where we attempt to solve the parenting puzzle together.
Welcome in, everybody. We have another edition of the Parenting Puzzle Podcast with Dr. Owen. How you doing today, Dr. D?
I'm well, Jake. How are you?
I'm doing okay. Public service announcement. We have an amazing episode today. This is real life, right? This is real life. Parenting is hard. You do it when you're sick. Got a little sniffle, but we're going to push through it. So I might not sound quite as eloquent as I usually do, which is questionable at best. But we're going to push through this because we are very excited about this podcast. We're going to talk a little bit today about mental health and how important it is for both parents and their kids to take care of themselves, and to seek help from that perspective when they need help. So today we have an incredible partner that I've dealt with personally in the past in my family, and has helped me tremendously with some of their outpatient programs. And we just want to help get the word out there for them. So we got Miss Teresa and Dr. Eberts. Did I do it wrong?
You did it right.
Look at that, Dr. Eberts. I was worried. You coached me a little bit, and we're getting through this thing. With Maples and Beacon Health. And we are so excited today to just have them on to share a little bit about their experience and how they help the local communities that they serve. So we are trying to move away as mental health as something that's a stigma and people are scared to talk about, to where people know that it's just like any other illness and that the resources are out there to help families and adolescents get the help that they need. So Teresa, whoever wants to start it off, we love you guys. Just to introduce yourself, talk about kind of your story about how you got involved with Maples and Beacon, and we'll just let it flow from there. Thank you so much for jumping on the podcast.
Wow. Okay. So I'm Teresa Jacobson, and I am a child adolescent psychiatric nurse. I got involved in psych way back, maybe over 30-something years ago, when I was working with a youth ministry, and the normal kids were getting drunk on retreat, and the normal kids were running away to my house. And I looked at my husband and I said, I got an opportunity to go to psych for 6 months, and I think I'll go so I can learn how to take care of these kids better, because I don't know what I'm doing. And so I ended up going to an adolescent and helping open up an adolescent substance abuse unit, and talk about baptism by fire. But I learned that this word normal is just not necessarily a good term to use. And instead of 6 weeks, I think I've been doing it 36 years. So my career has been long and exciting, and I'm happy to be here. And I am a mental health navigator. So my entire career, once I started doing outreach, was here's my cell phone, call me, and I'll help you figure out how to navigate through. Where do we go from here? Is this a crisis? I ran the Catholic Archdiocese crisis team for the city of New Orleans for 12 years. So I am a navigator, because you get this situation, you say, is it a problem? Is it not a problem? Do I need help? Do I not need help? Where do I go? And so my background is I kind of know the region and can help navigate.
So Teresa, I want you to talk more about what it means to be a crisis, regardless of where people are located. But let's hear first from Dr. Eberts, and then we can come back to that question, because it's a really important one that we want to make sure we cover today.
Make me go back. Okay.
Well, thank you so much for having us. My name is Stephanie Eberts. I have a PhD, LPC. My career started in schools. And then when I went back to school to get my PhD, I then worked in academia for some time. And what really drew me back into the field was what I've been seeing with some of the kids that I've been working with in my own private practice. And I just felt such a strong draw to come back and do the the more acute clinical work. And so I started back at the Maples about a year and a half ago when I left academia, and have kind of gone through various different roles. And I've landed at Genesis as the clinical director. And Genesis is our outpatient program. Genesis is both private practice and IOP for adults and for adolescents. So that's where I am now, and really enjoy, like Teresa was saying, interacting with the kids, their families, the parents, and doing the work in the field. It's been really rewarding.
Wonderful.
You see how much better you did cutting it short than I did?
Hey, we have you guys on this podcast because we want to hear from y'all. So we want to hear from you guys. Y'all are providing the insight today. And I just love what you said about, like, both of y'all talked about, like, the rewarding nature of the work. Like, to have a field and have, like, to have your job also match with your passion about helping adolescents and people has to be an amazing feeling, right? So I'm happy for you guys in that aspect of, like, having a job that fits your calling, right?
Well, and the patients feel it too, and I think that's a big part of it.
Of course. And Dr. D, I know you wanted to get back to something Teresa had said.
Yeah, I was just hoping that we could talk a little bit more. I know that your facility has different levels of care, but I was hoping that, you know, Teresa, you used an important word, which is crisis, a mental health crisis. And I was hoping you could just talk a little bit about what are some signs or signals that a youth is having a mental health crisis? And then, you know, what are the types of facilities that are available to families, or what should be their first step if they are concerned about a crisis to make sure they're getting their child help and the best kind of help as quickly as possible?
With parents, we want this equilibrium in our life. We want mental wellness. We look for that. And we try to get right back to that as quick as possible. Okay, so sometimes we're too slow to react, and sometimes we're too quick to react. But when you say the big crisis word in mental health, you're predominantly saying things like danger to self and others, or gravely disabled. And by gravely disabled, that would be when my child, when the angst, the anxiety, the frustration, or whatever we're seeing is interfering with daily living. You're going to mostly see it first. A lot of times when it gets severe, it's going to be somatic complaints. They're going to have the tummy ache. They're not going to want to go to school. You know, it's going to be a different complaint every day. Come pick me up. And I think for that's a warning. And you say, okay, where do we go? Where do we go? I mean, if a child is verbally saying, I want to kill myself with a plan, and that's their language, because that's their go-to language. Because a lot of times today, the kids, teenagers' go-to language is, I want to die. They're not able to say, I feel, I'm depressed, I'm anxious, I'm being bullied. They say, I want to die. And that's scary. And I would say that better to err on precaution with that. And when we get to that level, we end up thinking we have to go to an emergency room and make sure that they have to be kept safe. So that's the highest level. But our goal, of course, is as parents and as educators and professionals, is not to have to go to that level, but to start at the lower level. But I'm cutting on myself because that's how I'm getting out my frustration. Or I'm not bathing, I'm not eating right, I'm not wanting to go to school, I'm shutting down from my friends. All of those are when you're getting to the higher tier. Would you agree? I
agree.
I'm hitting the point. Say we have a situation and my child is being bullied, and my child is experiencing frustration with that bullying. First of all, I have had kids at Children's Hospital admitted for bullying. because the bullying has caused so much angst, anxiety, depression in their life that they come into the ER and say, I just want to die. I can't handle it. And as a parent, what do you do with that? You know, I say with everything that I'm talking about, we start young. Okay, we start young. First of all, we start with saying that I'm a champion. You're a champion. Teresa, you're a champion because you know when to get help. And when you need help, you know how to get it because you call for help. Whether it's my pastor, whether it's a good friend to start with, whether it's a counselor, whether it's whatever it is, my child's a champion, and I teach my child very young, you're a champion because you know when to get help. That is a strength. We all at some point in our life need help. And I teach when I speak to kids, I tell them that they're champions. I tell them that a bully is hurting. You think you're hurting from being bullied. Hurting people hurt people. So that bully is hurting. If a kid punched the wall in the hospital, which that doesn't happen all the time, but if something escalates, let's say, then I know to walk through the hospital and say, wow, you're hurting. Thank you for hitting the wall and not hitting somebody. You did a great job there. Next time, how about we talk about it? So I could go on and on. So I would say we get that crisis, danger to self or others, suicidal, homicidal, gravely disabled, not eating, not sleeping, not going to school. I got to go get that help.
That's great, Teresa. I want to just reiterate something that you said that's so important, which is when kids or teens use language of I want to die or I want to kill myself, it's very important. To your point, kids can sometimes use this just kind of off the cuff and not really mean it, but it's really important for parents to take this seriously. At the least, kids don't really want to die or kill themselves, and a parent that activates and takes them to the emergency department to get an evaluation shows I am listening to you, I hear you, and your well-being is so important to me that we are going to stop everything and go make sure that you are safe. At the other end, there is actually danger or risk there, and the trip to the emergency room keeps that child or teen safe. And so I think that's really, really important. I often hear parents say, but do they really mean it? Do I really need to go to the emergency room? In my experience, when you take any child or teen to an emergency room who is not suicidal, that is the last time they're going to use that language or use it without correcting themselves. No, I don't really want to die. I'm just miserable. And then you can work with your child when they're using language like miserable or depressed or anxious or angry. And if they really are in danger, they are able to be kept safe and they know that you want to keep them safe. So I really appreciate you explaining that because I couldn't agree with you more. Parents should always err on the side of safety and take kids to emergency rooms if they're using that language, because the other side of it is never worth it.
When I talk to kids, and because kids don't, oh my God, you're my best friend. And because you're my best friend, and I trust you, I have to tell you, I want to kill myself. And the kid goes, oh my God, what do I do with this? I don't want to rat. Or a parent goes, oh my God, what do I do with this? I don't want to overreact. And I tell the kids, I say, you use the language, and parents, you use the language, I care about you. And because I care about you so much, we are going to go now and see somebody. And I teach that same language to teenagers and to children early on to be able to say, I care about my friend. I care about my friend so much. I'm not going to go tell Miss James. We are going to go. Who do you trust? Let's go.
So I'm hoping, because a lot of families don't necessarily have experience with their child being hospitalized or in an inpatient facility. That might feel scary or uncertain. We just talk through what families can expect from a day in the life at the Maples, so they kind of know what it's like when their child is in an inpatient facility. And then I'm hoping, Dr. Eberts, you could talk a little bit more specifically about what it's like for youth to attend the intensive outpatient IOP program as well, so they can kind of just know what that is. I think a lot of families know, okay, traditional therapy, you go for a session a week or a couple sessions a week, but what are these other two levels of care? What do they actually look like?
Well, I can talk about Genesis and outpatient care. So one of the things that I always try to explain to parents is in the intensive outpatient program, we are going to meet with the children. In our program, it's 3 days a week for a little over 2 hours in a group setting. And so they're going to be with other peers who are dealing with similar situations, and they're going to be really focused on skill building and the reduction of, when we at the top of this podcast, we started talking about stigma and perhaps a lot of kids feeling like they're the only ones who deal with this. So a reduction of isolation, a reduction of I'm the only one who's dealing with this. So we call that universality. They have this sense of I can deal with this because I'm seeing other people who have dealt with this and who are having success. And so the group setting is a really powerful setting for that growth and development. And like Teresa was saying, that's going to be either a prevention measure for a child going into residential care. They may be coming out of an acute hospitalization where they needed to be stabilized. And so we're trying to do some skill building there. Or an individual therapist may say, this child that I'm working with needs a little more support. Mm-hmm. And so they're going to come to the IOP program. And in addition, one of the things that really drew me to both Genesis and the Maples was the parenting component. So in addition to the children meeting, and I call them children, they love that, our adolescents meeting 3 times a week, we also have an evening of parent education, parent support, where parents attend a group meeting where they learn specific communication skills. They learn about different aspects of parenting a child who has different needs than maybe what they were expecting, learning more about mental health. But they also provide support for one another, which I think is really important, because just like children can become isolated or feel isolated if they're struggling with some mental health issues that they don't see other kids struggling with, parents have the same concerns and worries. And they also need to have that connection with other parents who are dealing with the similar sorts of issues that they're seeing in their own household. A lot of parents will internalize and blame themselves, but really what we're striving to do is help to educate them so they can learn a different way of interacting with their teenager. And I found that to be a really helpful piece of the puzzle. So 3 times a week, and even like the kids like, this is a lot of therapy. I'm like, yes, it's called intensive outpatient therapy. In addition, we do ask that those adolescents who participate in the adolescent IOP continue to see their individual therapist. And that piece is really important, because in a group setting, even though we're there over 2 hours, they're not going to have that same level of, let me tell you every single thing that's going on in my life. And there might be some things that they need to process with their individual therapist. So it's a pretty intensive commitment. We run our program 10 to 12 weeks for each of the participants. And we found that extending the program has really helped with outcomes for, children to be in a situation where they feel much more stable. They feel like they've learned the skills. Their coping is increased, because what ends up happening, this is kind of a little bit of an aside, crisis for everyone is a little bit different, and it's so largely dependent on the coping resources that they have accessible to them, the healthy, positive coping resources they have accessible. So our goal is really to build those coping resources so that their crisis line grows. They have more capacity to cope. And because life for teenagers right now is incredibly challenging. Same is true for parents. This generation of parents has never had any models for how to parent with technology and things like that. So we're trying to grow resources to both prevent residential care, but to really improve long-term outcomes for the kids we work with.
And when you think about it that way, 2.5 to 3 months for 6 hours a week to be able to grow those life skills that are going to buoy them through adolescence and into young adulthood, that's kind of a small price to pay for a significant benefit, right? So
Absolutely.
sometimes when you break it down that way, yeah, that makes a lot of sense. Wow, that's wonderful. That sounds like a very valuable program. And I know lots of adolescent IOPs around the country work very similarly to yours. And so that intensive model where it's group work, there's a lot of skills being learned and practiced and processed and discussed in those groups. That is really important. Amazing.
And I love the point you made too about like this is a new era for parents, right?
Mhm.
With this social media stuff. Like back in my day, I experienced bullying, right? I think a lot of people have, right?
I
But
have.
like social media was not a thing, right?
Right.
So maybe I went to school and experienced some bullying, but then I had a sanctuary, my family home to go
Correct.
to, and that bullying was stopped for a weekend or the rest of the day or the summer, right? Now the kids these days, with all these different social media platforms, I'm not even sure what's out there, but there's so many now, right? So you can have an adolescent that is getting bullied at school and then come home and it should be a sanctuary
Mhm.
where it's family, it's uplifting, and it's all these different things like we had when we were kids. But now they're still getting inundated with all these comments and stuff on social media, right?
Mhm.
So it's just it's a much different realm. So for parents, it's more challenging than it's ever been to safeguard our children's mental health because they're getting it from all these different aspects. So I really like that point. It's a challenging time for parents, and
It really is.
it's so different than it was before.
Right. I was going to say in addition, there are additional dangers as well. And so, there are predators online that have access to children in ways that they didn't when we were growing up. And so, education is incredibly important. Um, really, just to not just to keep kids like physically safe from predators.
So, Teresa, what does a day in the life at Maples look like? It's not 2 hours a day, 3 days a week. It's 24/7. Can you tell us what that's like for the inpatients?
It's amazing. But what I will start with is y'all brought up a topic about these cell phones, and I mean, I have what I call Teresa Jacobson cell phone dysfunctional disorder. Like if I can't see this thing, where's my cell phone? What is it? Okay, I have it. I'm aware of it. It's my own personal issue. But we take away these cell phones from teenagers at the Maples. And our number one thing is safety. And so they come into a group setting with in Baton Rouge we have a 12-bed home, and so they're with 11 other girls, and in Hammond we have a 30-bed home. So you're coming into living in a secure, safe environment, but also you're dealing with a lot of things. These girls come into the Maples for 2 months usually. That's our average length of stay. And like Dr. Everett said, just like Genesis has a heavy parent component. I think one of the things that sets the Maples apart is that we have a heavy parenting component. The parents get once a week parenting, education, and then Tanya Stewart, who is the owner and director, does a family intensive where the parents, she just did it this past weekend, where they came Friday evening, Saturday, and Sunday from all over the country, if their girl was in the Maples, to be indoctrinated with parenting skills and work with each other and all the other parents and not feel like they're alone. So a life in the day of the Maples is very structured. The girls, they have to get up in the morning. They have to take care of their personal hygiene. They have to have their room straight because we're gonna do a room check, and so it has to be clean and organized. And then they come on down for breakfast. We do morning communication. We call it community, where we go over the rules. Imagine that, because we have rules. So we go over the rules every morning. We read the same rules every morning. And we talk about our day. Like, oh, today we might be going to the horses. And we go to equine therapy. So you need to go get your boots, make sure you're ready. If you come on downstairs, once you come out of your room, that's it. We don't go back in the room. The rooms are closed. It's safety. I don't have girls going in and out of the rooms. Everything's safety. At night, we check these girls every 15 minutes with a flashlight. Safety. If there's drama in the home and they fall in love or they fall out of love, we move them. It's safety. So in a life in the day, so we already got up to community. They go to group. They go to either they go to an educational group or they go to a therapy group. They go to school in the morning with staff to do homework. All the kids are connected to school. In the evening, they have 2 hours of school. We have a principal and a tutor. These girls get CBT, cognitive behavioral therapy, DBT, substance abuse education. We have an exercise physiologist that comes to work with the girls. We have yoga. The girls get to do we have outside activities. Baton Rouge is on 3 acres. So physical activities is important as mental exercises. They have art. They have music. Sometimes they have 90 minutes of individual therapy. We have 6 full-time therapists for 30 girls. So that's a 1-to-5 ratio, which is amazing. And so I think the
And
life.
I do family therapy.
Yeah, and they do family therapy. I think I said that. I don't know. I said once a week they do family therapy plus parenting. Thank you, Dr. Edwards. But it's a home-like environment with structure, rules, and teaching girls new ways to de-escalate and deal with their families in a safe and deal with their family. It's a little respite and deal with their emotions in a safer environment without all the distractions of the cell phone and the daily life outside. And we have 2 girls so far, maybe 3, that have gone through the program and are now in their 20, and they're working at the Maples.
That's a great explanation. So I'm hearing that it's safe and secure, that it's supportive, that there's a lot of learning going on, that there's continuity with education, so they're not falling behind in school, and that there are expectations, but it lets them work through whatever is bringing them in an environment that reduces the distractions from their outside life and lets them really, really focus on mental health and wellness with lots of support, and also developing good just life skills and habits, right, around exercise and being outside and being creative and all those other aspects. So it sounds like, it's kind of obviously a mental health focus with a lot of structure, but it sounds like there's also some fun that's happening throughout the day. And so it doesn't feel so limiting and negative. It sounds like there's a lot of positivity, and you can tell that because they stay in touch, and some of them have even had such a good experience that they've come back to work there to help others who are in a similar position to where they were several years earlier. So that's amazing. True testament.
I don't think I could have said that any better myself. You summed that up. Thank you.
Dr. D's the star of the show. There's like literally no doubt about
I
it.
mean, like, woo.
I think one thing, and I know we're a little bit over what we usually do, but I think this topic is so worth it. So one thing I've heard multiple times is the importance of the training of the parents, right? For both the Genesis side and the Maple side. I'd like to not deep dive back into that, but at least bring it up a little bit. Like, so parents that are struggling with something, how important is support for parents who their child or adolescent is going through this intensive therapy or mental distress? How important is that?
It's so important, which is not a clinical way of saying that. No,
Gotta be even better.
Right? No adolescent really comes to mental health care or even education without being attached to some adults. And those adults are, parenting an adolescent can be challenging in the best of times. You may not be called nice names by your child. Like it can be really difficult. But at the end of the day, those caregivers, those primary caregivers, are the most important person, or the most important people to this recovery, because they have the opportunity, or they can be the most important people in the recovery. They have the opportunity to really model some of those skills that the kids are working on. They have an opportunity to show their child that you're working really hard. I'm also working really hard.
Mhm.
I'm learning new skills. I'm changing as well. And we're going to do this together. It shows an investment in the child, which is also really important. You had talked, Dr. Owen, about how important it is to show your child that you're listening to them, that you validate what they're having to say. And just as our kids can be distracted by social media and internet and technology, so can adults, and adults are working. And so giving more skills and empowering a parent to really feel like they're making a difference in their child's life is one of the most essential pieces of this work, because ultimately they may call us or check in or come to alumni events. Ultimately, they are going home with their adults. And what we're really trying to impact is the system in which they live. And you can't do that by excluding parents from the process. And just sending a child home and saying, okay, I hope everything goes well. You really want to impact the system. And so when I say it's so important, it is. It's essential.
It's essential. Yeah.
Yeah. It's that structure too, because I think that when it comes to mental health and recovery, that word structure is so important, right? So when a child gets back to the home, like having that parent able and equipped to put in place some of that structure that's been implemented at Genesis or at Maples during the outpatient. It's also letting the child know, like, you're not alone in this. Like, we're a team, we're a family unit. Like, we want to help. We love you. We're engaged with you in this. This is not your fault. Let's find a path forward. So I love that. I love what you guys do. I think it's amazing. Getting the word out there on mental health and the resources that are out there. I think it's crucial. Dr. D, I'll turn it over to you. Any other questions or anything you wanted to say?
I think that was an incredible summary. I love everything we talked about today. So thank you both so much for
Thank you.
this really important
you.
information.
All right.
Yeah, we
Dr. D,
appreciate the opportunity.
we appreciate y'all. Come on. Dr. D, you ready for my favorite segment? All right, So, one thing that we talk about a lot is even in this topic today, it kind of makes sense, right? Getting our kids active. So just want to do a special shout out to our sponsor, Louisiana Flag Football. if you are looking for a way to get your kids active and engaged in a friendly and competitive environment where they have the opportunity to build skills and to make new friends, we recommend checking out Louisiana Flag Football. It's the premier flag football league in South Louisiana. If you want to register or learn more about it, go to this website, louisianaflagfootball.com, where you can register and get your kids involved in something new. They also have cheerleading programs now too. So it's for everybody. So go check them out. And we thank them so much for being part of this podcast and supporting us and jumping on board so quickly. So, Dr. D, let's do it.
So, what is really important coming to me from today's talk is that in different situations, kids and adolescents need different levels of healthcare when it comes to mental health. And the good news is there are different levels available. So crisis, or the potential for a crisis, is when a child or adolescent is at risk of harming themselves or someone else. And if kids are using the terms death or want to kill myself or suicide, parents should not hesitate in taking them to the emergency room for an evaluation. The clinicians in emergency rooms can help decide whether in fact there is actually a risk. And if in that case they determine there is a risk, they can help get kids involved in an intensive program, an inpatient program where safety, structure, and rehabilitation from a mental health standpoint is the focus. But as Teresa explained to us, these programs have come a long way from, what we watched in movies from the 60s and 70s, and they are comfortable, safe, secure, education-based. They use evidence-based treatments to help kids learn skills to cope with difficulties with mental health and really get them to a place of safety and wellness, and work with families and parents as well to help change the overall environment so everyone knows what to do when things get tough. And Dr. Eberts was explaining to us the value and the importance in equipping kids and adolescents with these coping skills, especially kids and adolescents who have had a crisis or who are struggling more with their mental health, taking the time to invest in a more intensive program where they can learn what to do, and families and parents know what to do. So when things get hard or scary, everyone is ready to handle them and can handle it better. And so these programs are intended to help teens and kids get through the hardest parts and come out at the other end with coping skills and an ability to respond differently in the future, as are their families, so that everyone can do better moving forward, and then hopefully be able to just sustain using other outpatient types of treatments available to them to help carry them through and maintain their mental health going forward. So thank you so much for teaching us all about this and how important it is, how valuable it is to listen to your kids when they're saying things are a problem. Listen to them. You always err on the side of safety, and the outcomes will pay out.
Exactly.
I think Dr. D, I could speak for both of us. We love shining a light on what you guys do, because I think the work is vital to our communities in South Louisiana and everywhere. So we love the opportunity to have you guys on the podcast. I learned a lot. So I'm confident and hopeful that our audience will learn a lot too. And this will drive awareness to a topic that I don't think is talked about enough. Right. So thank you all for coming and shining a light on this topic that needs to be talked about more. And if you got a lot out of today's episode and you want to support this podcast, or you want to support Beacon and Maples and Genesis and the work they do, one of the best things that you could do is like this podcast, share it, post it everywhere, subscribe to Dr. D and I YouTube channel. We're doing this. The why behind it is to get good information out there for parents, because parenting is so hard. Full stop. That's like our slogan on the Parenting Puzzle podcast. It's hard. So if we could keep doing this and getting really good information out there, We want to hear from you guys, and we want to support you in any way that we can. That's our why, is to help parents make this just a little bit easier. So thank you guys. We really appreciate it. And maybe there's obviously a lot of things to talk about here, so maybe we'll do it again one day. So thank
you
y'all so much.
Thank you.
Thank you so much.
Thanks for tuning in. We hope you enjoyed today's episode. If you did, please consider subscribing and leaving us a review. It really helps us out and lets others discover the show.